This is the Born Ludwig Year 1 podcast.
Good morning, Ute. Thanks for being with us and our Year 1 podcast. Ute Schneider-Moser from first Germany, later Italy. Thanks for being with me.
Thanks for the invitation, Björn. It's so nice to see you. It's really an honor and a pleasure to contribute to your podcast.
We decided within that podcast to be a bit different. I will not ask you a lot about your uprighting mechanics or if you prefer aligners or brackets. I want to know a bit who is Ute. Who is Ute Schneider-Moser when she is not treating patients, not teaching, not organizing, not speaking, and not being at meetings. This is actually my intention on this short interview.
Okay.
And my first question is, how did you come into orthodontics? Was that by accident? Were you forced by your parents? Was that your wish since you were in elementary school? What was your way into orthodontics?
Way into orthodontics. Well, I have to admit that orthodontics probably was not my first love because I was always very interested in periodontics.
Okay.
Actually, I wanted to do a postgrad in perio, but I had a dentist at that time who treated a lot of U.S. military patients because at that time in Frankfurt was a big military U.S. base. And he said, I have a friend and he's an orthodontist in Bad Soden, an American, trained by Brody. So he went to the University of Chicago and he's looking for an assistant.
Yeah.
And so go and talk to him and probably you will change your mind. And so I applied and I fell in love with orthodontics right away. From that moment on, it was clear that I wanted.
Was that orthodontics? His name was Douglas Toll.
Exactly. Do you know him?
Yeah, sure, I know him.
Yeah.
He was still alive when I was a postgraduate student. I think he passed away maybe 2010, something like that.
That's right. That's right.
And I think he influenced so many orthodontists during his career. He was a bit crazy, but a fascinating person.
Yeah. He was a fascinating person, but he was a forward thinker. And I can remember when I did my training with him that he was already proposing MARA, the mandibular propulsive appliance. He was doing a lot of positioners, not aligners, as we call it nowadays, but he did a lot of positioners for finishing.
Yeah.
And so, I became acquainted with all these relatively modern today appliances many, many years ago. Decades ago, I have to admit.
Yeah, when I remember he had these evenings where he gathered colleagues and displayed his ideas. He was talking about MRIs and special surgeries and repositioning bite ramps. You know it better because you were close with him. That was extremely progressive at that time.
That was progressive, and he already took up the topic of breathing. So we did a lot of interdisciplinary sessions with ENTs. He was very into interdisciplinary altogether. He did a lot of surgical patients, orthodontic surgical patients. So I really got involved from first day on with interdisciplinary treatment, which nowadays is very en vogue and very trendy. But I learned that from the first day on that we as orthodontists alone, very often we don't go too far. We need our colleagues to help us to achieve the best possible outcomes for our patients.
So you were trained in Frankfurt then as well as a postgraduate student, or you were trained in Germany, but where and how did you progress then?
Yeah, that's a very good question. It's probably a little stain on my curriculum, I have to say, because I started with Douglas Toll, and you know that in Germany we can do this mixture between clinical education and 1 year of academics. And when I was there, I met my husband, Lawrence, because Lawrence, at that time, he was an assistant at the University of Innsbruck, was working in the orthodontic department, and he was not very happy with his postgraduate education there. And he was always traveling far in search of the truth in orthodontics.
Yeah.
Up to now, he hasn't found it yet, I have to admit. But he was always looking for truth. And Douglas Toll, he organized weekend courses with some professors. Okay. And remember that Lawrence came and we immediately, I have to say, probably it was love at first sight. We fell in love and he convinced me because at that time he had already started to organize his office in Bolzano. While he was still working at the University of Innsbruck, he convinced me to quit my postgraduate education. So after 1 year, I left. I moved to Bolzano
Mm-hmm.
and to open the office with him together. And I interrupted my postgraduate education, and I interrupted it for a long time. So for many, many years, I was working just as a dentist without a specialty degree. And I was lucky that in 2008, Professor Siciliani, who was the head of the department of Ferrara University, he asked me about my postgrad education, and he discovered that I had interrupted it, so that I wasn't a specialist in orthodontics. And he invited me to join the program in Ferrara. So I went there for 3 years, and finally in 2010, I got my specialist degree from the University of Ferrara.
I feel that is a very inspiring way. It's honest, and I love it that you tell that to us, because so many feel desperate. I mean, it was 30 years ago, it was difficult to enter as a specialty. 10 years ago, it was still difficult, and it remains difficult. Many young colleagues, they almost give up. They say, oh, I will not make it. I have no network. I have no, in Germany, we say vitamin B, but still you can make it. If it's your passion, the way don't always have to be straightforward.
Mine was not straightforward at all. But, if you are practicing just orthodontics and you don't have the degree, I mean, you don't have the thorough knowledge, and you need a specialty degree in order to acquire the necessary scientific basis, to perform well, then you feel not guilty, but you feel insecure.
Yeah, I understand that. You feel insecure. Yeah, you feel insecure. And you know that German dentist, Franz-Peter Schwindling, with the biomechanic guy who has his books, and I think he is above the level of biomechanics, higher than Ravinanda or Bursten. And he's just a dentist.
I know.
And he always reminds me it's about our passion. I mean, degrees is one thing, super cool. And I think it's something we should strive for, to have a certain basis. But on the other hand, I think passion and doing it and living for something, it's also quite important in our profession.
Absolutely. You have to be able to do your stuff correctly.
Yeah.
So, especially. But I was lucky to, sorry, Björn, but I was lucky to have Lawrence. I have this fortune in my life to work together with Lawrence, and Lawrence was always very into biomechanics and into lifelong learning. So we did a lot of courses together. We have to say that we are autodidacts, and this is probably an advice I would like to give for the younger generation. Try to get into a good postgraduate orthodontic program, because doing it all by yourself, trial and error, and this is what we did for many, many years, is quite cumbersome. And if you do a good postgraduate program, maybe you can save yourself all these insuccesses that we went through, the retreatments, etc., because you have a better basis to work on.
I agree with you that going into a good program, having a good teacher. But on the other hand, I mean, beside that the patient maybe suffers, that doing that autodidact has something, because you dig deeper into it. You read journals, some books, you want to do it. I have many now young postgraduates coming to me, tell me how to do it, then I can do it. And somehow I feel annoyed about that question at time, because I think, why not going like Lawrence did and you, on the road, on the search for getting better? I think it has to be a kind of mixture.
Yeah, but you need a basis. I mean, you have to know your stuff about growth and development, about biology. You don't want to harm, so you cannot try out everything that is on the market that you probably find intriguing, but you have to put everything in the context of biology and biomechanics, sound biomechanics, I think. So trying out things is good, but having a basis to rely on is important.
Just comes to my mind, together, you and Lawrence, how many patients did you treat up to now, since you started? The number, just the number.
Now our 40th anniversary. We started in 86, so this is 2026 now, so really 40 years in practice, and I think we've treated almost 40,000 patients. We are very diligent, very diligent. When we work, we really work.
Unbelievable. So finally you made your postgraduates, and you were both as a couple, but I see you as separate persons inspired me a lot. I went to your first course 2001 or 2002. And over time, you became much more than a clinician. You became a teacher, a speaker, a society leader. You do reviews, a mentor. How did that come into it? Did you decide at one point, I want to be more? or did it come gradually? In example, maybe many people do not know you were the president of the Engel Society, US, certain part, the eastern part. You were president of the CEDAW. I mean, we could go on for an hour, no? But how did that come?
I think Lawrence inspired me a lot. Lawrence is a person that always strives to become better. Okay. And he was always very keen on sharing knowledge. So I have to say that he was my role model from day one. And we started relatively soon after having opened the office to publish. We had interesting patients, very interesting patients. And I like writing. He likes treating more than me. Okay. I'm the writer of the family. He is the treating orthodontist. And he wanted to publish right away important case reports, probably a little clinical study. So we got into contact with the CEDAW, with the Italian Society of Orthodontics, relatively soon. And interestingly, on the German side, Professor Mietke from Berlin,
Reggie?
Reggie, he came to know us and he invited us to write some articles for his journal relatively soon about missing teeth in the aesthetic zone, about certain retention devices. And so from day one, we were also active in contributing to the, let's say, scientific literature. And then Lawrence started to become a diplomat of the European Board of Orthodontists. He was invited to the Engel Society for Europe. And I always backed him up, of course. So it was a team approach. We were doing it more or less all together, always as a team. Sometimes me in the background, sometimes him in the background. And of course, when our son Max was born, he was born in 1995, I stepped back a little bit, concentrating more on the family, but still working in the office full time. That's what I did. But we did less lecturing, less university teaching. But I always tried to keep pace in the background, never quit completely, but try a little bit of a, I don't know how you say, a spagat, okay, between family and clinics. And then Lawrence did a lot of promotion for me. And it was probably the right momentum that female leaders in orthodontics were searched, were looked for, they become popular, I would say. And we have many more female leaders now all over the world. Okay, sitting in boards of journals, sitting in boards of the universities, of societies. So I think I was a little lucky too, because, I had quite a good network that supported me.
I still feel we have too less females as speakers, researchers, and prominent positions, all the lecturers. At times I feel women are smarter and do not need this attention. Lawrence and I think we are quite similar. At times we need a bit too much attention. Women don't need that as much. In example, I'm looking for a speaker for a conference or for a podcast. It's very hard to convince a woman. They say, no, I have my priorities. I do that. And it's lacking a bit, to have a balance. At the moment, I don't think we reach 50-50 lecturers at the conference. It's close to impossible.
No, it's not 50-50, but it's gradually improving internationally. Okay, you see many more female speakers now on the podium than before. And the societies are really striving to motivate more females. And of course, it's time consuming. I mean, still, you want to raise a family. Well, most of us want to raise a family and want to dedicate time to the children, because otherwise, why would you make children, right? But I think everything has a certain time in life. I wouldn't have been able to do what I'm doing now or what I have been doing for the last 10 years with a little child around, okay, or with a teenager at home. So, of course, there are phases in a woman's life where you have to concentrate more on one thing and probably give less attention to the other. But you should never lose the contact, okay? So never say, I don't have time. You can find your time. You can find time for reading. You can find time for publishing. You can find time for being a mentor to someone. You just are not allowed to waste any time.
That's true, not to waste. I'm the master in wasting time. I ask my community, what speakers do you want to see at this podcast? And for the females, you were clear number one. And everyone asked, ask Ute about her style. And it's a fantastic style. And she's so shining and she's so strong and she is just perfect. And I should send you the list. If you have a depressed face, you should read it.
I so.
But people, at times we both have contact. I mean, not weekly, not monthly, but we keep contact. And you also share your not so good moments, and when you are a president of something, when you are doing that is behind that picture, maybe, and that picture is good because it motivates the younger ones. There's also some difficult phases, some doubts, especially when you are in a very strong role. If you have these doubts, if you have these difficult phases in your professional career, what helps you keep going? Because I always see you kept going. What helps you to keep going?
Well, again, it's my husband, whom I can really rely on in every situation. It's not a husband, he's my partner in crime. He's really my everything. So when I'm down, and sometimes I'm down, who wouldn't be, I can always rely on Lawrence. Good advice. He always has an open ear, and he really emerges into the problem. And of course, it's easy for us because we share the same profession. It would be probably a lot more difficult if he had another job.
Yeah,
Okay.
yeah.
So there's a complete understanding on the other side. And there's always time. It's not that I come home and my husband doesn't want to hear anything about my business because he's also stressed, but it's perfect to have Lawrence by your side.
Mm-hmm.
So this is absolutely great to have somebody who understands you on 360-degree level.
Yeah.
Then I have a very nice son, Max, who is always comforting me. He was supporting me. And if I feel down and I need a good word, sometimes I call Max. And Max, from a different standpoint, because he lives far away, he's in a totally different community. He gives me very good advices to see things a little more from the outside and sometimes just to let it go, okay, to not think about it, do something different. Just reward yourself with a good weekend or with a good book. Just don't think about the problems you have at the moment and then come back after 1 or 2 days and try to solve them, which is great.
Yeah, yeah. Is Max more the mother's son or more the father's son, or did it change over time?
A good mixture. It again, phases. Okay, he's a very good athlete. He's a keen golfer. He was a very good skier. So this is Daddy's part, and he's very good in writing too. And he loves art. So I love modern art. I always dragged him into some exhibitions, into some museums, which at a certain time when he was young didn't like. But I see that the interest is growing and that he has implemented a lot of things that he didn't like when he was young now. And sometimes he thanks me for it. So
Okay.
that I have been so insistent to push him to do things which he didn't like at this time, but they are now rewarding, you know.
How did you experience your path, a woman in orthodontics? Did it change over time? Because I get the feedback from some female colleagues that they feel at least they had a bit higher obstacles to enter universities or lectures, or even I remember when we opened our office, we were about 30 and we both looked quite young. And then I think the female part was less appreciated than the male part because they thought the patients thought, she's so young, she has no competence. How did you feel at being a female over time of your career in orthodontics? The society change? Did your gender be a disadvantage, advantage, or neutral?
I have to say neutral because I was always well prepared. You know, I was very good at school, so of course I had no difficulties in entering the dentistry program. I finished very fast. I was always well prepared. You know, I'm a little bit of a perfectionist, I have to say. It's probably a little antipathic, but it's the way I'm constructed in my head. You know, I don't sit exams when I'm not perfectly prepared. I know my stuff. I try always to be in the upper 10% of everything. So I didn't have any difficulties, particularly because I was considered a woman and less worthy. Absolutely not. I had done one harassment study, a harassment problem during my undergrad studies, but I resolved that.
Okay.
Because if you don't want, I mean, if you dare to say no, there is no me too. Okay, so you just have to know how to defend yourself. That was one little story, and I almost forgot it. And afterwards, it was just, you have to be prepared. You have to know your things. I never got any degree or any advantage because I tried to flatter somebody or
Yeah.
to behave like a typical female, being well-dressed and being very soft, I never used these female charms to get anything. I was always prepared. I knew my things, and therefore I did never rely on any benefit that is probably given to a female that's offering her female attraction.
I mean, you are very well dressed, which is impressive, but I feel the same when within our communication, I don't feel like we are speaking a man to a woman or the other. I think it's very comforting to be with you because it's neutral. And that is extremely nice. Yeah, there are no gender roles, and I think that is exceptional. And I feel that is the future of the society and profession that we see us as human, and not in our typical, depending on the culture, gender role.
I have never thought about it, Björn. I have to be honest. I was never treated badly because I'm a female. On the contrary, I had probably the fortune to have mentors that supported me. Okay. And of course, you need mentors. Everybody needs mentors, females and males as well. And this is probably a good advice already at the university. Go out and seek a teacher or a mentor that believes in you and that gives you some leverage. You can't do it all by your own. It's not only studying hard and performing well. You need somebody who believes in you and who motivates you and who gives you the network or the connections in order to excel. This is very important.
Giving you the network, I think that is something so important when we are older, to share the network with the younger ones, to open it up, to say, I invite you to my network. That's a good point.
Now, this is very important because you can be the smartest and the most diligent, the most hardworking. If you don't get any visibility because you don't have this mentorship, then it's really tough. And I try to do this. And I think I'm relatively good at that. And I have a nice network all over the world because I believe in these hardworking young women. They are outstanding. But the same for males as well. If I see that a young gentleman is doing extremely well, why not promote him? I mean, I'm not only promoting female orthodontists. Why should I? It's merit. It's merit. If I believe in a person, if I think that the character is okay, then of course I'm doing some leverage for this guy as well. Why not?
Yeah. So a bit about innovation. You are open to innovation. Let's say you are open. I mean, I see you have 3D printers, you start with aligners, but somehow you don't follow it blindly. Yeah? We compare each other. I follow innovation at times a bit blindly. What would be your advice to the current generation about innovations? How should they filter? I mean, I love your style because you are way more cautious. How could we summarize it somehow? How do you have some rules, or does it come naturally? Being open to innovation, but still not following it blindly?
Well, of course, you have to be open to innovations because you want to improve, right? You want to improve your results because up to now, I think I've never treated a perfect case in my whole life, and I'm still striving for it. So that keeps me going, by the way. And of course, if you're doing a lot of interdisciplinary, for example, you need the new technology in order to communicate with patients, to communicate better with your team members. And we are open for innovation. Absolutely. We have a CBCT, for example, but we are not using it on every patient, for example. We are using aligners, as you say, but judicious use of these innovations is our motto. And of course, if there's something out on the market which seems to be intriguing, we read a lot about it. We ask the experts. For example, you were so kind to invite me to your office and to give me a one-to-one course on digital technology, and we appreciate it. So we are contacting the experts, and we are trying to dig deeper in the topic, trying to read everything that is published. And then when we think that there's really an advantage, we are implementing it into our daily life, but we are not jumping on the bandwagon just because some crazy guy publishes something on the internet or on Instagram and says, okay, I can do beautiful expansions of the palette with these and these devices. But we are cautious, as you say, cautious. We are trying. Okay, we are clinicians. We're not working in an academic setting. Our patients expect that we treat them with proven concepts. And not with innovations where the sound basis, the knowledge base is lacking. So, we're doing innovation technology or we're implementing it, but only after a certain time. We're never using it right away, just because we find the concept interesting. We love new concepts, but yeah, we are cautious.
Sometimes I use you and Lawrence a bit like an oracle and like a crystal ball, because I have learned that you have a super gut feeling. Maybe it's experience or whatever. When you say you don't need tats for that, or you don't need a hemi section or whatever. At first I said, why are they saying that? That is annoying. I would say in 100% of your predictions, you were correct. So now I started to listening more, and I love your experience and gut feeling. That is wonderful. I don't have that. It's fantastic.
You have it for sure. We are very skeptical. This is by nature, both of us.
By nature.
By nature, we are skeptical. And we always ask ourselves, okay, do we really need it in order to improve our results? This is why we didn't implement skeletal anchorage right away, for example. This is the hot topic and a lot of discussion topic between us, right, Björn? But nevertheless, being very critical with our results. We are now starting, for example, to use skeletal anchorage for class 3 patients. Young class 3 patients, not the youngest ones. You know, we like to treat them very early at 4, 5, 6 years of age, but sometimes they come later. And when we want to advance the maxilla, for example, we cannot rely on our traditional mechanics. We are not able to move the maxilla sufficiently forward without creating dental-alveolar compensations. This is a fact, okay? And we have to admit it. And we should have implemented it earlier, okay? I have to be very, very clear on that. While on the other hand, using skeletal anchorage for expansion is overrated very often. Okay, we see these screws in the palate in very young patients where we think, are they crazy? Why are they doing it? Okay, it's not the right thing, not the adequate treatment for the respective patient. So we are very autocritical with ourselves as well, and with our reluctance even not to use skeletal anchorage. We should have used it for certain malocclusions earlier. For example, the mid-face advancement. Absolutely. Or the control of the vertical. You are able to control the molars better, okay, when you use skeletal anchorage. And for open bites, it's an asset. It's something you have to consider. You cannot do it with traditional mechanics as well as with skeletal anchorage.
I agree. That's maybe the strongest indication. Eruption control with skeletal anchorage.
Change of the occlusal plane, okay, because very often the surgical problem instead is a vertical problem, as we know. So we should have implemented that earlier. But we are not too old to learn.
I have 3 questions left. We have to be a bit quicker. So one thing which is on my mind, what should never disappear from orthodontics? I mean, despite despite AI, what is coming? What is like 1, 2, 3 things you say, this should never disappear from orthodontics? This is set for us, for you.
First thing, ethics.
Ethics.
You are a fan and a big friend of Peter Greco. He is our common role model, I would say. So the ethical component in our treatments is crucial. Okay, you always should ask yourself if what you are doing for the patient, you would also do for your family members. This is absolutely prior. What should never disappear? We think extractions.
Good one.
Which is not very trendy nowadays because everybody tries to avoid them, but there are still strong indications where removing some teeth is still the best way forward. And what never should disappear as well is interdisciplinary treatment with surgery, refraining from too heroic orthodontics, which we have done for a long time because we had problems finding a good surgical team, but we are paying the price in the long term if we are too let's say it heroic, too much dental-alveolar camouflage, and we are harming our patients. So interdisciplinary with orthodontic surgery and trying not to camouflage too much should not disappear from orthodontics, I would say.
You still have so much passion. You thought about retiring, not by age, just by the possibility, but you keep going, which is for me a huge motivation, and that you still strive. And I can recommend to all of our listeners, follow Ute and Lawrence on Instagram, because their latest office videos they share are amazing. It's such a wonderful balance between innovation and still keeping classic orthodontics alive in the most beautiful way. That's fantastic. I love it. I checked it a few times. And the question is, where do you see orthodontics in the next 10 years? And what should young orthodontists prepare for? Maybe 10 years is even too long. I cannot see 1 decade. It's, let's say, in the next 5 years.
In the next 5 years, well, I think it's still happening. It's already happening that we have orthodontics as a multi-level calling. There are the dentists and the not so well prepared orthodontists that are performing sort of, let's say, fast food orthodontists. Leveling and aligning and selling appliances to their patients. Okay. And then these super 3-star Michelin orthodontists that are providing really top-notch treatment, working a lot interdisciplinarily, trying to implement the latest technology and trying to strive for the best possible solution for the patient. So I think that there's a big abyss between orthodontics at a low level and the highest level. And in between, I don't know what is happening in between. Unfortunately, a lot of things are happening because of the aligners that are now sweeping across the world like a tidal wave, and they have ruined our orthodontic profession, I would say. So for the orthodontic specialist, difficult cases are going to be the bread and butter. Retreatments, this is what I see. And as it is so difficult to get into the specialty program, a lot of orthodontics is going to be performed by general dentists and by some probably masters in orthodontics. And this is going to make a big difference between the quality that is out there.
Yeah. I still feel that orthodontics is a super business. I mean, I'm not so much into business when we earn still good money, but differently like 20, 30 years ago. Differently. It's not like blindly following an archwire sequence or everything. Feel the quality. Thanks for saying that the cases got way more sophisticated. It's not copy paste. It starts from the very beginning, from the first consultation. It takes longer. The treatment plan writing takes longer. The execution takes longer. So, yeah, I agree. Thanks for saying that. I feel exactly the same.
Well, it was so easy in our area because we were almost the only orthodontists at that time to sell a treatment plan with the patient. Patients came in, okay, they said, please take a look at my mouth and prepare a treatment plan for me. We did that, and then they accepted usually right away. Now they're going out and ask for a second and third and fourth opinion, okay? Probably to find somebody who is cheaper, who is not performing extractions, who does camouflage treatments, etc. But in the end, what pays is that you have your clear setting, that you are not surrendering to what your patients want, but you are trying to guide them and you're trying to convince them that what you have excogitated for them is the best possible treatment solution. Be patient. Don't sell your soul because you just want to sell some treatments. In the end, if you are patient and if your treatment plan was the correct one, even if it's not accepted in the first place, these patients are going to return. You just have to wait.
Decades ago, we had the second opinion, which was at times a pain in the ass. Then came Dr. Google, and now we have the AI who giving advice. I think it's the same problem, the same thing, just in a different color, but you get it now from different channels. And I don't know if it happens already in Bolzano in Italy, but we have these face maxing, especially with male patients, that they want to maximize their face. We have it now almost weekly. Young guys, class 1, actually beautiful people, and then they come and say, I want a different jawline. I want to live, and then they need a MAPI, and it's heartbreaking because they are beautiful. And what should you do? I feel that's a new challenge. Did you see such patients already?
We've seen them, but we try not to get involved in their treatment because what they have is a severe psychological problem. So we always refrain from treating this kind of patient. They are just very difficult and you cannot satisfy them. If they have done one intervention, they are thinking already about the second one, and it's a never-ending story. So better don't get involved with that.
3 final questions. What is overrated in orthodontics? Overrated. It could be like your current emotion. What is annoying you where you say, oh, go away. That's overrated.
The breathing issue. The
Okay.
breathing issue is overrated. Expansion as a panacea to solve all the problems like breathing, bedwetting, and whatnot.
I agree. What is underrated?
Taking care of the periodontium.
Okay.
Taking care of the periodontium, being too focused on aesthetics. I mean, we are focused on aesthetics as well. We know that patients come to see us in the first place because they want an improvement of their smile or of their face or whatever. But we should not deny that the periodontium and the bone where we move the envelope, okay, where we move our teeth has to be taken into the consideration. And sometimes you should probably put the aesthetics in a second row and try to concentrate more on the long-term benefits of orthodontic treatment.
I had this week 2 patients of mine. We are close to debonding and both established a recession at the lower anterior teeth, and believe me or not, both I treated with extractions, but I did not carefully position the incisor. It was a wrong torque and we postponed and blah, blah, blah. And now I have to stretch the treatment, rebonding, different mechanics and so on. And I was so angry, and I fully agree with you. It slips below the carpet. I'm not attentive enough, and then it happens.
Happens to us too. Happens to us too, because it's difficult to control an extraction case. It's so much more difficult than just to round out with an archway. And during the finishing stages, you have to be so meticulous and so careful. And it's really difficult to keep the lower incisor roots in their bony envelope. Even if you extract teeth, because you're retracting, the crown comes back and the roots stay forward. So you're absolutely right. But nevertheless, extractions are still indicated.
No, I would do it again. It was my fault, my problem. I lost a bit of anchorage the classical way, and we are going against it. But the patient pays now the price because we have to prolong treatment unnecessarily. Even I had the photos. I mean, I felt ashamed because of you. You told me that taking photos every appointment. And you see it already 2 appointments ago that it's establishing, but I was blind.
I can tell you it happens to us as well, Leon. Okay, because not always you're looking so meticulously. You're focused on one thing in the mouth and you don't see the other. And then the important thing is that before you take off the appliances, you realize it so that you have some remedies in order to get rid of this problem. This is important.
Final question. What would you tell your younger self? Would you do the same professional way like you have done? We met first in 2001. What would you tell the Ute in 2001?
My big problem was this postgraduate thing. Okay, I was already telling you. So I suffered from that. So I would tell the younger generation, go out and find a good postgraduate program and invest a lot of time into your education, because life is long, okay? And there's a lot of time to earn some money. The better you are prepared, the more successful you are, the more you love your profession, the better you serve your patients, and money comes when you are providing excellent service. You don't have to strive for that. So don't go out and want to open your office because, of course, when you have studied in the US, you have a huge student loan. And, of course, you have to earn some money, okay, to get your office running. But invest in your education. And it's never over. It's lifelong learning. This is why we established the AngleNet together with Renato and the Angle Society. And you have established your wonderful webinars. And it's a lifelong learning. You learn, you give, you teach. It's reciprocal. And this is what keeps us going, Björn. Okay, we have received so much from our mentors, from our teachers, and we would like to give something back to the newer generation, because we were lucky. We had somebody who supported us, who believed in us, and now it's our turn.
Yeah. So thank you for taking your time this morning. And I think if the world would have more Utes, it would be a better place. And you are 1 in a million in our profession. And I hope you keep inspiring us for many more decades as a colleague and a wonderful human, and not just as a woman. I love that you say, I don't care about gender. I am.
Absolutely
I love
not. I hope that the good Lord gives us some good years. You know that we have bought our office back in January this year, and Lawrence is
So strong.
72. I'm 65. So this is the biggest challenge we are facing, and we're praying every day that good health is going to accompany us, because we still love so much what we're doing, and we have still a lot of energy. And yeah,
You have a lot of energy. Just when I see how you restarted your business, and with how much passion you do that, it's
yeah, we love
good
what
to see. Good
Yeah.
to see.
Like you, Björn. We are made of the same wood, probably.
Okay. Thank you, Ute.
Thank you. Thank you. It was a pleasure and an honor. Take care.